The Vice President, Honorable Jessica Alopo, arrived at Kizinga Town Council in Bushenyi District to officiate the World AIDS Day 2025 commemoration representing President Yoweri Museveni. The Vice President Alopo also toured exhibition stalls from the various HIV stakeholders. In his address, the Director General of the Uganda AIDS Commission, Dr. Nelson Musoba, reported encouraging progress in the national HIV response. He revealed that 94% of Ugandans know their HIV status, 90% are on treatment, and 96% have achieved the viral suppression.
94% who are testing and knowing that they have HIV, only 90 are going for treatment. So we need to step up there. It means we have a percentage that's out there. They have the virus, but they are not yet enrolled. The risk.
Dr. Musoba also added that although stigma remains a barrier, 97% of Ugandans on treatment are responding well, reflecting strong adherence and improved health outcomes.
For those who have been able to go for treatment, they are doing so well. That's why we have 97% viral load suppression. It means those who are on treatment are not transmitting. But we still have new infections. Last year alone, we had 37,000 new HIV infections. So that's the other small percentage.
Minister Babidi Miri Babalanda reaffirmed government commitment to ending HIV/AIDS by 2030, emphasizing strong partnerships and evidence-based interventions.
Akawuka tekakyali kizibu naye nammwe abatanakafuna kyali bate kirungi ne mwekuma obutakafuna nammwe abakafunye ne musigala nga muli ku ddagala okulaba nti kino tekikyali kizibu tetukyeraliikirira nti tugenda kufa kubanga siriimu kubanga akakooko here in Bushenyi they call it akakooko okuba nti abantu baffe bagenda kufa lwaki kino nakyo nze nkifudde oba nkitadde ku gains za NRM government.
Stakeholders and religious leaders also called for the continued support, reduced new infection, and greater encouragement for the people living positively.
We continue to work despite the funding cuts, unwavering in our desire to save, but mostly save another life. We are leaders and we lead.
We are concerned with the slow progress in the rollout and call for expansion of coverage to reach more communities as a sustainable response demands collective action to ensure equitable access to these life-saving technologies.
Uganda remains committed to achieving epidemic control by reducing new HIV infections by 65% among the elders and the youth and lowering pediatric HIV infections to below 5% by 2025. On the global scene, United Nations Secretary General Antonio Guterres, while delivering his message on the World AIDS Day, acknowledged that the global progress against HIV/AIDS is undeniable. He noted that since 2010, new infections have dropped by 40% worldwide. The AIDS-related deaths have fallen by more than half, and access to treatment is now at its highest level in history.
The progress we have made is undeniable. Since 2010, new infections have fallen by 40%. AIDS-related deaths have declined by more than half, and access to treatment is better than ever before. But for many people around the world, the crisis continues. Millions still lack access to HIV prevention and treatment services because of who they are, where they live, or the stigma they endure.
However, the Secretary General expressed concern that the crisis is far from over for millions across the globe. He warned that many people still lack access to HIV prevention and treatment services, often because of who they are, where they live, or the stigma they continue to face.
These are putting lives at risk and threatening hard-won gains. Ending AIDS means empowering communities, investing in prevention, and expanding access to treatment for all people. It means uniting innovation with action and ensuring new tools like injectables reach more people in need. At every step, it means grounding our work in human rights to ensure no one is left behind. Ending AIDS as a public health threat by 2030 is within grasp. Let's get the job done.
As Uganda joins the globe to commemorate the World AIDS Day 2025, leaders emphasize that while progress is strong, the fight continues with renewed commitment from the government, partners and communities. Uganda remains firmly to track towards ending HIV/AIDS by 2030 and securing a healthier future for all.